Today we're going to talk about 4 common types of headaches: migraines, tension-type headaches, cluster headaches, and medication overuse headaches. So let's continue with cluster headaches. Cluster headache is a primary headache, much like migraine, and it's not associated with any underlying brain pathology. It's sometimes referred to as suicide headache due to the extreme pain it inflicts, making it one of the most excruciating types of headaches. This condition is more prevalent in men. The attacks of cluster headaches are typically shorter than those of migraines, lasting anywhere from 15 minutes to 3 hours without treatment. The frequency of these attacks can change a lot, occurring anywhere from once every 2 days to as many as 8 attacks per day. During an attack, the pain is usually felt around the eye or the orbital area, as well as in the forehead or temple on one side of the head. Importantly, the pain stays on the same side for the duration of a single attack, although some patients experience side switching between different attacks. To qualify as a cluster headache, at least one of several accompanying symptoms must be present. These symptoms include red or teary eyes, nasal congestions or running nose, eyelid swelling, forehead or facial sweating on the painful side, a drooping eyelid or pupil narrowing on the affected side, and an inability to stay still, as affected individuals often feel a compulsion to move. Around 90% of people who suffer from cluster headaches experience the episodic form, characterized by periods of frequent daily attacks lasting from weeks to months, followed by remission periods that last at least a month. On the other hand, about 10% have chronic cluster headaches, where attacks persist for over a year without any remission. Interestingly, some individuals may start with a chronic form, while others may develop it after experiencing episodic headaches. The origin of cluster headache attacks can be traced back to the hypothalamus, a crucial part of the brain that helps regulate hormones and circadian rhythms. Acute treatments include sumatriptan injections, high-flow oxygen therapy, and zolmitriptan. On the other hand, preventive options include medications such as verapamil, certain antiepileptics like topiramate, gabapentin, and levetiracetam, as well as lithium. In cases where other treatment fails, a greater occipital nerve block may be considered. All the above are just recommendations, and for the final decision, you ought to talk with your doctor. On another note, medication overuse headache can develop when analgesic such as paracetamol, NSAIDs, or opioids are taken daily for headache relief, leading to dependence. For instance, it is advised that NSAIDs should not be taken for more than 15 days per month. If the frequent use of medication stems from migraines or other headache types, shifting to preventive treatment is often recommended. This approach aims to lower headache frequency and reduce reliance on medication. Medication overuse headache typically presents as a diffuse, non-specific headache that resembles a tension-type headache. However, the diagnostic clues may include a detailed history of painkillers intake and negative results from tension headache-specific tests. Treatment from medication overuse headache usually involves stopping or significantly reducing medication usage, which can lead to a reduction or resolution of the headaches. Overall, understanding these headache types, their symptoms, and treatment options is vital for managing pain effectively and improving quality of life.